It is that time of year, time to send the kids off to summer camp, and Dr. Janice Johnston is with us this morning to talk about a couple things parents should know before the kids go. So thanks for coming in this morning. Let's talk health issues. What should parents be doing now if they're preparing to send their children off to summer camp in the next week or two?
Well, the biggest thing is to make sure if your child needs a form, a sports camp form that needs to be signed by a physician, that you go ahead and get that done so you're not sort of scrambling at the last minute.
Right.
A lot of camps do require that.
What does that include? Does that include shots and immunizations, things like that, or?
Well, a lot of times it's just making sure that if your child has any kind of chronic problems, that the camp counselors are aware and the physician is involved to help to direct the care. So, you know, if a child is needing vaccinations, it's a great time to get your child updated. So if we use it as a well-child exam as well, too.
So parents have responsibilities, but the camps also have some responsibilities, right? What should the parents expect from the camps when it comes to medical issues, health issues, things like that?
So we're really, it's for kids who have chronic illnesses such as asthma or diabetes, maybe some sort of severe allergy that they have, just to make sure that they understand what's wrong with your child, to make sure that they understand the medications that they need to use on a regular basis. Kids with asthma, that can get serious very, very quickly, to make sure that they have what they need beforehand to go, and to also, educate your child as well, too, as to the signs that they need to expect so they can raise a hand and go to their counselors when they need help.
Yeah, if it is a sleepaway camp, do you think parents should expect the camp to have some sort of nurse or medical professional on standby at all times?
Yes, I do think so. Do they have CPR training? Do they have some additional, the training in medical issues would be a huge plus.
So those are fair questions to ask. I mean, what kinds of training have your counselors been through? Do they know CPR? Do they know standard first aid? That's fair to ask, clearly.
Oh, absolutely, yeah.
Can we talk about some other things which might be unavoidable, especially if you're at sleepaway camp? What about, like, bed bugs? Is that an issue?
Everybody's, that's a hot topic, bed bugs.
If I was a parent, that would be a concern. What are the kids bringing home?
Yeah, so bed bugs are a thing, and it doesn't matter where you are, that you could be at the nicest hotel and you could still have exposure to that. So, checking mattresses, making sure everything's clean. Bed bugs look like a little apple seed, and most of the time kids are bringing sleeping bags with them, and they're probably going to be okay. Bug bites in general are going to happen at camp. So, and most of the time a bug bite is not a big deal. It's just more of a nuisance kind of thing.
Yeah, so. I mean, that kind of stuff is unavoidable, but would you be a parent that goes in there and, like, lifts up the mattress just to check what's scurrying around? I mean, is that crossing the line, or is that legitimate?
To me as a parent, I would think, you're there to go have fun and not get freaked out about bugs in your bed, so.
You brought up allergies, and, we've all heard stories about peanut allergies, things like that. At this point, you find a lot of camps are just avoiding things which can cause such a severe allergic reaction, just to play it safe. Yeah,
I think they are, and I think most schools are doing that as well, too. So peanuts are a huge problem, right? And so, yes, I do think that they're just avoiding those things in general.
And another thing, another allergy or another issue, bee stings. A lot of kids will go to camp never having experienced a bee sting, which I find strange because I was stung like a million times as a kid. But a lot of my friends have children who've never been stung. Is there a way to tell before your kid goes away to camp if they might have that allergy?
Not really, no. So it's going to be an individual reaction. And, the first time that you get stung by a bee is not likely to be a severe, significant reaction. So, most of the time it's a local type of thing. When you worry about having a really bad reaction to a bee sting, you would get short of breath and, breakout in hives, that kind of thing. That would be a significant allergy. That typically doesn't happen on the first time. It's more of a repeated kind of thing where your reaction will get worse and worse over time.
So it's a little bit of a comfort for parents. All right, Dr. Janice Johnston, thanks so much.
You're welcome.